active for 6 or 7 or 8 minutes, maybe once or twice a week. That's not physical activity, and that's not using sport to its full potential. And so we need to be rethinking some of these kinds of assumptions. We need to develop healthy food policies for our schools. And fortunately, some good things are happening in Ontario. I know, I'm not familiar with other provinces in order to begin to improve the quality of the food that's available to our children. But it's more than just getting junk food out of vending machines. It's making sure that there aren't birthday treats 4 times a day, which involve acres of muffins and high-fat, blah, 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 blah. And I'm not the wicked witch from the West that wants to deprive young people of pleasure. But it's important that we begin to think critically and constructively about ways in which we could, when we're worried about low levels of physical activity and burgeoning rates of obesity, does it make sense to be funding high school sport programs which affect maybe 5% of the school population by sending hundreds of kids out selling chocolate bars? I don't think so. We need to really get a handle on what we're doing in terms of the environments that we create. We need to ensure that there is appropriate daily physical activity. We need to re-examine food policies. In the early part of the 20th century, public health policies focused upon the purity, the sterility of foods, and the accuracy of the volumes and weights and measures. In the 21st century, we need to be talking about the quality from a nutritional point of view of those foodstuffs. And I realize that people in the fast food industry and the dietary and various snack food industries recoil in horror when we talk about taxation. But at the end of the day, I think we have to think about creative approaches to trying to provide disincentives for the consumption of unhealthy foods and incentives for the consumption of healthier foods. We need to ensure our communities are designed appropriately. Not every community in Ontario or in Canada enjoys the array of amenities that we do in Ottawa that facilitate physical activity. And we need to think about ways in which we can take already existing facilities in our communities and make them much more creative, much more engaging, much more attractive, and much more supportive of a variety of physical activities. In the introduction, it was alluded to the fact that we've been trying to address some of these issues in the Champlain region. This is the Champlain region, the very heart and soul of the province. Interestingly enough, this is a microcosm of Canada. 20% Francophone, 3 distinct Aboriginal communities, an urban center, remote service communities, some truly remote communities. And so if things will work in the Champlain region, they have a good chance of working elsewhere. But what you also see here is that when you live in the city of Ottawa, you are living in this instance, cardiovascular Shangri-La. Because in the city of Ottawa, people generally are pretty active, are less likely to be obese, or have a very low rate of smoking. But if you go out to other areas of our community, Eastern Ontario, Renfrew County, Leeds, Grenville, and Lanark, you see that the rates of cardiovascular mortality of various risk factors are enormously higher than they are in Ottawa. And so we attempted to address that, and we attempted to, one of the elements that we've initiated, or one of the programs we've initiated, is the Champlain Declaration, and everybody celebrates that for the first time in Canada, school boards have actually got together and agreed to do something in common. What a concept. And this declaration was developed by the 9 school boards and public medical officers of health in our community. And so we have developed an approach to standardize, if you will, across our region, approaches that are likely to optimize nutrition and support and stimulate physical activity. Our European colleagues are addressing some very specific issues, particularly as it relates to encouraging children to walk to school and in urban environments, establishing safe bicycle routes, etc. I introduced you to Rudolf Virchow earlier on in this presentation. You know, disturbances in human culture cause disturbances in epidemiology. Rudolf Virchow also said there are 2 causes of disease. One is pathological, the other is political. Meaning that it is neglect or insightful action that can create or impede the acquisition of the healthy community. Action on the part of politicians. And I don't say that in a partisan way, but you know, in Canada, we've been described as being terminally nice. We don't want to rock the boat. And I think it's very important that we understand that we are dealing now with a crisis, that there is evidence to support taking action in certain ways. the public cynicism about this is going on. Political pressures are going to be building, and therefore there's a need and an opportunity for leadership. And it means that we've got to get away from and move away from those assumptions which may have impeded action in the past. It means that as parents and community leaders, we need to be advocates for transformed approaches, transformed environments. In the health professions, we talk about the ice escalation of authority. The fact that when doctors and nurses and health scientists and health promoters and health educators speak out on issues of health, they're listened to, because they're not seen as arguing for a special interest or for their own particular area. They're not asking for a bridge to be built through their backyard or for tax relief for their particular industry. They're acting on the basis of knowledge, insight, compassion, and wanting to contribute to a healthier community. And Arthur Koestler, who was perhaps one of the great 20th century novelists, said it best when he said that if the Creator had any purpose in equipping us with a neck, He surely must have intended for us to stick it out. And I think it's time we begin to stick out our necks. I think it's time we began to engage the connections between our cerebral cortex and our larynx. It's time to begin to speak, to talk, to write, to express our views on these kinds of issues with those who are in a position to be able to affect the policy changes which will create these environments. The kind of people that 100 years or more sat around and had earnest discussions in this very physical space in which we are today. And at the end of the day, beware. Ignorance, those who are unaware of these realities. Indifference, those who really don't care about it or think it'll all be solved by somebody else. But most deadly of all is inertia. The inability to understand the necessity to act or to move forward. The challenge, ladies and gentlemen, I think is that we want to develop a population of young Canadians who are active, who are vigorously active, and whose vigorous activity and optimal nutrition stands to make them one of the healthiest young people in the world. And as a consequence, their health, their vigorous activity serves almost as a Canadian cultural trademark. And one of the ways that we can start to do that is simply to begin to send our children out to play. Thank you very much.